Welcome to this comprehensive mock interview guide for aspiring cardiologists. Today, we're diving into key questions that you might face in a cardiology interview. Let's get started with a question about teamwork, crucial for any cardiologist during complex procedures. Can you share an experience where you collaborated closely with a surgical team to successfully complete a challenging procedure? This question is all about understanding your ability to work effectively with a team in high-pressure situations. It's essential for ensuring patient safety and successful outcomes. To tackle this question effectively, here are some tips to keep in mind. Start by describing a specific procedure you were involved in. Highlight your role and contributions within the team. Emphasize the importance of collaboration in overcoming challenges. Share any obstacles you faced and how you worked together to resolve them. Conclude with the positive outcome and any insights gained. Now, let's look at an example answer to see how you might structure your response.
In a complex angioplasty procedure, I took the lead in coordinating with the surgical team. I ensured the imaging equipment was ready and communicated the patient history effectively. When we hit a snag during the procedure, our team collaborated smoothly to adjust our approach, resulting in a successful outcome and a satisfied patient.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for cardiologists. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Tell me about a time when you faced a challenging case where your initial diagnosis was incorrect. How did you handle it? This question assesses your problem-solving skills and your ability to learn from mistakes, which is crucial in refining your diagnostic skills. Here are some insights to help you answer this question. Select a specific case that showcases your diagnostic process. Explain the initial diagnosis and why it needed reconsideration. Discuss the actions you took to arrive at the correct diagnosis. Reflect on what you learned from the experience. Share how this experience has influenced your practice moving forward. Let's walk through an example to visualize how you can approach this question.
Once I diagnosed a patient with stable angina due to classic symptom presentation. However, further testing indicated myocarditis. I consulted with a colleague, reviewed the patient's history thoroughly, and conducted additional tests to confirm the diagnosis. This experience underscored the need to consider less typical diagnoses, influencing how I approach similar cases now.
Describe a situation where you had to deliver difficult news to a patient or their family. How did you handle it? This question evaluates your communication skills and emotional intelligence, both vital for fostering trust and understanding with patients and their families. To craft a thoughtful response, consider these tips. Select a specific example that highlights your experience. Clearly and concisely explain the situation. Focus on how you communicated the news with compassion. Demonstrate your emotional awareness and empathy. Conclude with the outcome and what the experience taught you. Here's how you might structure your answer with an example.
I had a patient with advanced heart disease and needed to inform the family of the prognosis. I invited them to a quiet room, spoke in clear, simple terms, and avoided jargon. I gave them time to process and ask questions, ensuring they felt supported. This reinforced the importance of empathy and clear communication.
Imagine you're in the middle of a procedure and the patient suddenly develops arrhythmia. What would be your immediate actions? This question tests your ability to remain calm and decisive in emergency situations, which is crucial for ensuring patient safety and effective treatment. Consider these strategies when forming your response. Stay calm and quickly assess the situation. Confirm the type of arrhythmia and monitor vital signs. Administer the appropriate medications as per protocol. Consider synchronized cardioversion if needed. Communicate clearly with your team and prepare for further intervention. Let's see an example to illustrate how you might handle this scenario.
First, I'd assess the patient's vitals to confirm the arrhythmia's severity. I'd administer necessary medications such as antiarrhythmics and prepare for cardioversion if the arrhythmia was unstable, all while keeping the team informed and ready for the next steps.
If a colleague disagrees with your treatment plan during a procedure, how would you address this? This question explores your ability to collaborate and maintain professional relationships under pressure, ensuring the best outcomes for patients. Here are a few pointers to guide you in answering this question. Stay calm and listen to your colleagues' concerns with respect. Quickly and objectively evaluate the disagreement. If needed, call for a brief timeout to discuss the issue. Use evidence-based medicine to support your treatment plan. Ensure patient safety and well-being remain the top priority. Here's an example to help frame your answer.
If a disagreement arises, I'd listen to my colleagues' concerns and assess their validity. If necessary, I'd suggest a brief pause to discuss our perspectives, ensuring our decision aligns with patient safety. I would emphasize evidence-based reasoning while being open to valuable insights from my colleague.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free. Just grab it below.